I have a booming voice, but we'll use the microphone. Thank you, and first and foremost, thank you to Kyra and the entire elite team for organizing this event, for recognizing the importance of, for inviting all of us. We're grateful for being here today. I can't describe one particular issue or factor to school violence. I would say this though, from the mental health perspective, if you look at those tragedies that have drawn the most attention in our society and across our nation over the past half dozen years, whether it's Newtown, whether it's this past summer in the movie theater in Colorado, whether it's the unfortunate incident in Arizona that claimed several lives and left Congressman Giffords impaired, to the Virginia Tech campus shootings. Oftentimes afterward, we hear from people who say of the perpetrator, yes, you know, I sat in the classroom next to that person, or I knew them from a distance and you perceived that there was something wrong or something odd about them, which suggests to me, and we know that, you know, social isolation and pushback of people who need help, who require help, certainly has to be a factor. And I don't know if anyone else has other.
So, just as a reminder to everybody, there's so much good information to share today, but if we could just try to be mindful of 30 seconds, because everybody has so many important points to share, so just please be mindful as we move forward. Thank you.
When I stand, I project better when I stand. I think there's a lot of factors that go into school shootings, and I think one obvious one is the easy availability of guns to people who should not have them, whether those be kids, whether those be people who are dangerously mentally ill. And I think it's important to start by understanding the scale of the problem. More than 30,000 Americans are killed by guns every year in this country. More than 30,000. That's more Americans than were killed in 9/11, both Iraq wars, the war in Afghanistan combined. Killed every year in this country. More than 2,800 kids and teenagers are killed every year in this country. That's 80 kids and teenagers per day. That's a classroom every 3 days. That's Newtown every 3 days. This is a tragedy. We're better than this. We can do better than this. And together, I know we can accomplish a great deal to address this problem. Thank you.
I would just like to direct my comments to trauma in general. I'm a trauma specialist, and one of the reasons I started my company is I saw that more and more children, very young children, were being exposed to some horrific trauma. And so I knew that there was a need out there in the community, and I guess I would ask all of us, like, what is that about? Why do we have such a violent society? Why are children being exposed to domestic violence, to substance abuse, to sexual abuse, to physical abuse? I think it's a very complicated question, but one thing I can say is that trauma is transmitted from generation to generation, and what happens is if we don't get, as parents, we don't get what we need as children, then it's very difficult for us to give that to our own children. And so we are coming up on a generation of children that cannot self-regulate, they can't soothe themselves, children that have a difficult time feeling empathy for other people, that are always activated because of the trauma that they've experienced. And I think that has a lot to do with, I do a lot of work in Head Start and preschool, and I see some pretty aggressive young children who are hitting teachers, who are spitting, who are attacking other kids. And I think it's just, we really need to look at the generational trauma, and we need to look at what we are doing to help these families and these children.
I'm pretty good with voice as well, I understand that. Exactly, Jane. I want to echo something Paul was saying earlier, because when you look at the factors that go in, I'm a psychologist, so I look at factors that go into things like school shootings. And there are unfortunate convergence of issues that can contribute to these very unfortunate issues. And one of which I think is kind of an elephant in the room that we don't really talk about enough, and that's how we take care of our children and adolescents from a mental health perspective. And very often we see these tragic cases, and we again hear afterwards, well, you know, I thought this person was a bit disturbed, or could have used some help, or maybe they reached out for some help, but that help wasn't forthcoming. aspect that we're also looking at as well, particularly for Sandy Hook and stuff, is how people use other mass shootings as a copycat model. I know that there were some issues around that Manson being obsessed with Anders Breivik, the mass murderer in Norway. So there's a lot of issues that we need to talk about as a society, and I think we're doing a good enough job about having those conversations, and I think that's something that we should be doing.
Sometimes in the answer we forget the question. Moderator, I'm going to ask you to ask the question again, and then I'm going to give you my answer. Please, one more time.
The question was, what is the number one contributor to school shootings and violence?
Human rights. Thank you.
Okay, thank you, everybody. The next question is directed toward the gun policy experts. According to the ATF, in 2009, there were an estimated 310 million guns in the United States. However, only 20% of the population owns 65% of those guns. What effects will this have on the safety of our communities? Angus.
Well, I'm not here to argue that people shouldn't own guns. I'm not here to suggest that guns should be prohibited. I think if people want to make that choice, knowing the statistics, knowing the dangers, that's their choice. The concern is, how do we keep guns out of the hands of criminals, domestic abusers, people who are terrorists, people who are dangerous and mentally ill? We need stronger laws to accomplish that objective. And the fact is that the percentage of households that own guns in the United States has gone down over the past decade. The number of guns that are in private ownership has gone way up. So what does that tell us? It tells us that people who already own guns are buying more and more of them. Now, again, that's their choice. My concern is keeping them out of the hands of criminals, domestic abusers, terrorists, and people who are dangerous and mentally ill. We need stronger laws to accomplish that.
Thank you, Angus.
Ask you to repeat the question again to make sure I'm absolutely accurate in my answer.
Sure. According to the ATF, in 2009, there were an estimated 310 million guns in the United States. However, 20% of the population owns 65% of the guns. What effects will this have on the safety of our communities?
It's a very interesting question, and because the statistics that our research really shows is there are about 270 million guns in civilian possession, which is an alarming number of guns when you think about it. But then that's about 89 guns for 100 people. Whether or not it impacts the safety of the community is another issue. But I want to borrow some words from the mayor of Newark, Cory Booker, who said that all these shootings occur, the terrible shootings that we have in Chicago, the gun violence and places like that, these are not law-abiding gun owners doing these shootings. These are criminals with illegally owned guns. And to Agnes's point, I mean, I'm going to borrow from some of Lindsay Webb. I don't want a criminal or somebody who's mentally adjudicated as being unfit to own a gun to have one round, one bullet. I don't want that in. But by the same token, I want to be very careful that we protect the rights of lawful gun owners and there's not infringing this.
Thank you very much. The next question is directed toward the mental health care specialist. What is the main cause of neglect for mental health care in America, especially for children? Paul, if you could start us off.
I think the major reason for neglect is that we simply don't give it the attention that it deserves. There are approximately 310 million people living in the United States at the moment. There are, on any given day, an estimated 50 to 60 million people who suffer from a diagnosable mental illness. There are an estimated 300,000 young people under the age of 24 living in Massachusetts right now who suffer from a diagnosable mental illness. We know that half of lifetime cases of mental illness begin by age 14, and yet we don't respond to that. Our nation rallied in the 1950s when 3,000 young people lost their lives to polio, and very quickly a vaccine was developed, and now we don't deal with that as a public health issue or epidemic. We need to address and give the same attention and consideration to mental health as we do to any other illness.
Thank you, Paul. Diane?
What Paul says is right on. I think that part of the problem is that we are a reactive society. I think that we respond to things after such horrible things occur. services and really value that, I think that you would see some differences in our society. I'd also like to say that I think that in order to do that, we really have to look beyond ourselves. I feel like we are a very individualistic society. We are not collectivistic. So we think about ourselves, how it's going to impact us, how it's going to, our bottom line. We're not really thinking about the good of our society and what we need to do to help one another. And I think if that mindset was shifted a little bit, I think that we could value mental health services in this country.
For now over 20 years, I've talked about facts, given you facts, given audiences like this facts, lectured on facts, and I think we're all aware now of various facts related to firearm injuries in children. In my 25 years of experience, I go back to my original statement, my first statement. What we are lacking in children, as compared to what we have been able to do for blacks, for women, for gays, is the issue of human rights as it pertains to children. Until we are able to address the human rights of the child, we will not be able to do much with these facts. So human rights in children is where we have to go. Other countries have been able to get there. We in the United States have not been able to do that. Thank you.
Matt, can I ask you a follow-up question? Because, and this is directed towards all the mental health care specialists as well. Building upon what you just said, 2 million teenagers suffer from mental illness, which is 8% of the adolescent population. If children and teenagers suffer so much from mental illness, why have there been budget cuts on psychiatric departments nationwide, and what can be done to curb those budget cuts?
You're asking the pediatrician a very politically oriented question. As the leaders of this assembly have today, these young students have been able to do, and what they've been able to do and demonstrate to us is courage. There are so many politicians, so many healthcare workers, so many mental health specialists, so many governmental leaders, so many educators who do not yet have the courage to do what is absolutely right to protect our children, to provide the level of human rights for our children that we are providing for others. Thank you.
This year, the government introduced an $85 billion spending cut. What did they cut? Women's health, domestic violence victim assistance, WIC, which is Women, Infant, and Children Services, and Head Start. I think it's pretty clear as a society what we value. We need to start valuing children. We need to be looking at their rights, as this gentleman had said. I also want to mention that in terms of insurance companies and how they reimburse for mental health services, I think this system needs to be looked at as well. I think insurance companies are unfortunately very out of touch with the reality of mental health. I mean, everywhere you look, there's waiting lists for mental health services. I think a lot of people can attest to that. And unfortunately, when people like me are trying to get clinicians credentialed, we are told that there are enough providers in your area, so we don't have to credential anyone else. And so I've been fighting for 3 years to try and build a team of specialists to work with children and families impacted by trauma. And it's been a lot of, as they say, hoop jumping through the insurance companies, because really, I don't mean to be cynical, but insurance companies are in the business to make money. They're not in the business to help people. So I think that system has to be looked at, and we have to look at how we're providing support to the people that are doing this work, so that there won't be so many people that are in the field.
Thank you, Zach.
Thank you. I will frame my response this way. If any one of us in this audience today were suffering from a high-grade fever for 48 to 72 hours and the medication we were taking at home didn't reduce that fever and rid us of that illness, we would call our primary care and they would say, get this person in here immediately, or they would direct direct you to urgent care. Yet, if we call and try to find a clinician for one of our loved ones who is in need of mental health assistance, sometimes we're told, number one, if you can even find a clinician who has enough time on their schedule to see you, that it would be a 2 to 3 to 4 month wait. We would not accept that for any other form of illness, and yet we tend to take our heads and separate it from the rest of our body when we need to think of this in a holistic way.
We're going to do 2 more questions and then take one from the audience. This one is for the gun policy experts. Would the renewal of the 1994 assault weapon ban be effective in preventing or decreasing gun violence? And the follow-up to that is, how would you respond to someone claiming that the assault weapons ban was unsuccessful? Let's start with Steve instead.
What's the question again? A lot of studies have been carried out looking at the effectiveness of the original Clinton-era so-called assault weapons ban. A lot of studies have suggested that the outcomes of that were basically it was statistically insignificant, that it didn't do very much to actually change the rate at which people were being killed with these weapons. I think you have to put that in the context. If you don't mind, I'll quote a couple of statistics for you. Americans murder Americans, and they find very innovative ways to do so. And unfortunately, the FBI's data from 2011 showed there were, I don't remember the numbers, it was about 12,653 people were murdered in the USA. Of that number, 323 were murdered with a rifle of any kind, right? Not just an assault weapon. So when you look at that statistically, and it's a very small number, so I'm going to turn the numbers around. That data shows that 99.974% of homicides were carried out without using a rifle. So I think it was an ineffective ban. And don't forget that Massachusetts still has the assault weapons ban. It didn't sunset, as does Connecticut, which didn't sunset either. So, and again, you have to look at what the crime rate happened in Massachusetts. We had a gun law change in 1998, which has basically set crime 2.5 times up where it was before violent crime. And emergency room discharges basically doubled because of that. So I would say that the original preliminary assault weapons ban was unworkable. And again, when you look at the proposals from Dianne Feinstein, they're so onerous in terms of what we're trying to do to law-abiding gun owners. I just don't think it didn't work before, and I think that's why the people are dropping it from the House and Senate. It's not going to work again.
Thank you very much.
I think we've all seen that semi-automatic assault weapons are the weapon of choice for rampage shooters. We saw it in Newtown, we saw it in Aurora, we've seen it over and over again across this country. Would I advocate to pass the prior assault weapons ban as it was drafted then? No, I wouldn't. It wasn't strong enough, it wasn't comprehensive enough. I would advocate for you to pass a comprehensive, meaningful ban on assault weapons, and just as importantly, a ban on high-capacity ammunition magazines, so that 30-round clips like those used at Newtown are not available. But just as importantly, we need to have universal background checks. That's what the Senate's going to be considering over the next 2 weeks. If you want to make sure that no gun is sold in this country without a background check, prevent a criminal or a domestic abuser or a terrorist or somebody who's dangerous and mentally ill from getting their hands on a gun, call your member of the U.S. Senate. Tell them you want universal background checks on all gun sales in America. Right now, 40% of gun sales are private sales, not through a dealer. No background check required. Cash and carry, no questions asked. You don't even need to show an ID. You don't even need to keep a record of who they sold the gun to. That's wrong. That loophole needs to close if we're going to have a safer society here in the United States. Thanks very much.
Okay, so the final question from the panel discussion, I apologize we can't do rebuttals because I think it would be great. We just don't have the time, unfortunately.
I'm sorry, but I can't sit here and have that comment made without having someone have the rebuttal.
Steve, I appreciate that, I respect that, but unfortunately at this time we can't do that. So the final question is, in our community, what specific things, and what I would like all the panelists to do if you would, is to identify Have the opportunity. So why don't we start with Matthew on the end?
I would do everything possible to get the United States to sign the UN Charter for Child Human Rights. We are one of 2 countries, Somalia being the other, that have not signed that. I would do that.
Personally, what I would do on this, and just one thing, and there's a multiple list of things we could do to make things better. I would try and dispel this myth that we have of these pretend gun-free zones. When you look at these mass shootings that occur, they're all in college campuses, school campuses, movie theaters. Remember the James Holmes shooting in the Arizona movie theater? He picked a movie theater that had no gun policy. So I would try and dispel this myth of no gun zones and do something to protect our children.
Thanks, Steve.
I'm not sure I know the answer to this question, but I don't think the answer is to give teachers guns. I think that we need to be very proactive about our stance. There is a program, I don't know if people have heard about it, called ALICE. People heard of this. It's a proactive approach. It's an alternative to lockdown, and it really incorporates tactics and knowledge and skills to prepare schools for something like this. But I think I go back to making kids feel safe where they are in their families and where they are in their lives. I go back to supporting them, and that brings me back to mental health and valuing that. So thank you.
Thank you.
I will do what I am doing. I will try to catalyze people who care about this issue to raise their voices and to make a difference. Because we need to address this problem. Guns are too readily available to people who shouldn't have them, whether those be kids, criminals, mentally ill, dangerously mentally ill, the domestic abusers, terrorists. They're too readily available. So what I'm going to do is I'm going to work to pass universal background checks at the federal level. I'm going to work to pass stronger, more meaningful gun laws at the state level. Massachusetts has one of the strongest sets of gun laws in the country. And we have the second lowest gun death rate of any state in America to show for it. Gun laws work, but only if they're crafted in a way that are meaningful and comprehensive. So I'm happy to work with any of you here who want to accomplish that goal, try to get it done. Thanks very much.
Thank you.
Thank you. Thank you for making the distinction about dangerously mentally ill versus the 50 million people who may be suffering from an anxiety disorder, an eating disorder, dementia, Alzheimer's, because that includes many people, including many in my own family. If there is one thing that we can do as a society to improve safety within our schools, it begins with all of us. We need to talk about this openly, with confidence, and with a comfort level. In the past 2 months, we've had the opportunity for the SHINE Initiative to speak to students at St. Bernard High School in Fitchburg, at Holy Name High School in Worcester. We've spoken to over 1,000 high school students. There are other schools now that are asking us to come in and speak to their students as well. And we deliver a simple message and a simple one-page fact sheet and say, take this home and share this with your parents. Make it part of your mainstream conversation. And it's remarkable how mature the students have been in their response to what we've had to say. They've come to us after every presentation, including a 15-year-old who said, I have a 14-year-old sister, and I think she's suffering from depression. My parents seem to think that it's just puberty and going through a phase. I think it is much more than that. We need to help, get her some help. What can I say to my parents? I had a 16-year-old who approached me and said, a girl that I had dated and that we'd broken up just recently attempted suicide a month ago. And the parents are blaming me in the breakup. And I said, don't beat yourself up, because there's far more to it than that. We need to talk about this, and it begins with each and every one of us.
Thank you, Paul. We have one more question from the audience. It's Chelsea Lashlow. Chelsea. Great question. This is for all 5 of you. What advice would you give teachers on how to help their students deal with trauma? Paul?
There are some wonderful programs in place with professionals, including some who are, I believe, in the audience today. I can't see everyone. Teachers, I believe there are, again, programs that are in place so that you can do that. Counsel your students, but also engage parents, because this can't be just a separation. It needs to be a combined effort.
I'm a parent myself. I have two young kids. The root of a lot of these problems, and it's not all of them, it's not every school shooting, but I think we all know that bullying has played a factor. So I would advise educators, and I talk to my own kids' teachers about this, take bullying seriously. It's a serious issue. It leaves kids traumatized, and it creates situations where conflict is almost inevitable. So that's the one thing I would advise teachers to focus on.
I do a lot of consultation with teachers around this specific topic, and I think education for them about what's going on inside of them in terms of trauma. Most people have a trauma history. They've had something really bad happen to them in their lives, and oftentimes when we're working with these kids, that comes up and can trigger the teacher, and it can actually impact the way they work with this child, the way they see this child, even how they communicate with their parent. So I think education for teachers and support for teachers is very important. I also think that kids need a place that people can listen to them. I think a lot of people say that, well, when they bring a kid in for services for trauma, they say, okay, the only thing you need to do is get the kid to talk about the trauma and then they'll be okay. But that really isn't the case. Most people that come in to see us need lots of preparation and need to help them feel safe before they can even go to that trauma. So I think people need to understand that trauma is very different. It's a different animal. It's not just something that you can talk about. It's a neurobiological problem that changes the brain, and we need to understand it in that way so that we can be more empathetic with kids, so that we can see their behaviors as something that is not because they're being bratty or not because they don't know how to behave, but because they are being triggered. To have compassion for them, to not make, I tell the kids I work with, trauma isn't an excuse, it's a reason. So it's a reason for behaving that way, it's not an excuse, and helping teachers to understand the difference.
I think I echo what Diane was saying really about getting people help with trauma. I've seen combat-related trauma up close and personal, and it's very difficult sometimes for people involved to actually deal with it, get help, and get some treatment. And when you're dealing with children, again, I echo some of my mental health colleagues up here and say it would really help teachers understand how children deal with trauma and get this out. It's a difficult subject.
Thank you. I have to echo and second the comment made about bullying prevention. We need to make our educators bullying prevention experts. In Pennsylvania, we've been able to implement, monitor, evaluate the largest bullying prevention initiative in the country. We have seen significant change in our schools with that effort. So I second that. Also, teachers, we need to help them to be the best teachers they possibly can be, and that will go a long, long way. Thank you.
So, this concludes our panel discussion. Before we thank everybody, I just want to comment to all the speakers on behalf of the league. We're tremendously appreciative of you coming today. The number one goal of the league is to just open up the lines of communication on these topics, and all five of you did a great job of that. So if the audience will join me in thanking the speakers. If you would all exit off the stage, and thank you. Please join me in welcoming back to the microphone Ms. Kyra Hall.